A new study is giving women the most detailed look at their personal risk of developing breast cancer. Researchers have created a personalized risk calculator that could change how doctors approach screening and prevention.
Joining us now is Dr. Paul Barron, Chief of Breast Surgery and Director of the Breast Cancer Program at Lenox Hill Hospital. Welcome.
Thank you. Thank you for inviting me.
Dr. Barron, this study is being called a major step forward in understanding breast cancer risk. Can you explain what makes this research so groundbreaking?
Sure. So what the study did is looked at over 60,000 women and who had what's called pathogenic mutations, which is the same thing as genetic mutations that most of us talk about. And it showed that those who have a mutation and have an increased risk for breast cancers, things that people know like BRCA1, BRCA2. They also looked at some other genes called PALB2 and ATM. They showed that even though their risk is elevated, that they can modify their actual risk based on diet and other lifestyle changes. So we quote people what their risk is of developing breast cancer if they have one of these mutations. We find that even though there are things they can't control, like having the gene mutation, there are things they can control, like lifestyle changes, which will lower their risk.
And how does this new risk calculator differ from, the standard genetic testing that many women are familiar with?
Great. So it's basically the same genetic testing. So there's about 11 or 12 different genes that increase women's risk for breast cancer, whole spectrum, things like CHEK2, PALB2, ATM, and then the BRCA1 and 2. And what we usually do is see the patient, we quote them what their lifetime risk is. But now what this study has shown that those people who have a family history of breast cancer and let's say are obese or have high alcohol intake, it shows that those people, they can lower that risk by just changing their lifestyle. Again, minimizing alcohol intake, minimizing estrogen and progesterone intake, and they can lower their risk. So that's very helpful and it's reassuring to the patients that they can actually make an impact, because a lot of times people have a gene mutation, they just assume there's not much they can do about it, but turns out they can.
And let's talk about those lifestyle choices. What are some of the biggest changes women can make to lower their risk?
Yeah, so the biggest changes that the study looked at, that they looked at BMI, which made a little bit of a change, but the biggest thing, which is basal metabolic rate, but the biggest ones was like alcohol intake and estrogen and progesterone intake. They found that those people who had one of these mutations, particularly one called PALB2, which is almost like a BRCA3, if they have a high alcohol intake and they take estrogen and progesterone, their risk of breast cancer is actually the highest of the group. So if they don't take that, if they don't do that, then their risk is lower. See, because a lot of times people who have a gene mutation, they feel there's not much they can do about it. And in all cases, these patients, we usually follow them very closely with regular screening mammograms and breast MRIs. We commonly will alternate them every 6 months, like you get one test and 6 months later you get the other test. So I think that is staying about the same. But it shows that if patients really somebody who may be considering mastectomy, prophylactic mastectomy, it may show that, hey, you can just help yourself by just changing the way you live.
All right, Dr. Paul Barron, Chief of Breast Surgery and Director of the Breast Cancer Program at Lenox Hill Hospital. Thank you so much for joining us.
Thank you for inviting me.